Now we'll discuss about the intracanal medicaments. Originally, endodontics was a therapeutic procedure in which the drugs were used to destroy the microorganisms or mummify the vital tissues, affecting the sealing of the root canal space. So, these drugs are being used as intracanal medicaments, ever increasing the number of endodontists use them only for symptomatic cases. Coming to the functions of the intracanal medicaments, they destroy the remaining bacteria and limit the growth of the new arrivals. And in case of the apical periodontitis, in cases of the inflammation caused due to the over-instrumentation. And what are the indications of using the intracanal medicaments? They help in removing the remaining microorganisms from the pulp space and dry the weeping canals, and also acts as a barrier against the leakage from an inter-appointment dressing. And they also neutralize the tissue debris. So we'll see the properties of an intracanal medicament. It should be effective as a germicide, fungicide, antimicrobial in action, and they remain stable in the solution and even active in the presence of the blood and the pus, and they do not interfere with the repair of the periapical tissues, and they are capable of inactivation in the culture media, and they have the low surface tension, and that should not induce the immune response. Coming to the classification of the intracanal medicaments, the essential oils include the eugenols, whereas the phenolic compounds includes the phenol, paramonochlor, camphorated phenol, chrysatin, and aldehydes such as the formocresol, paraformaldehyde, glutaraldehyde, and the calcium hydroxide, and the halogens such as the chlorine, sodium hypochlorite, and the iodine, chlorhexidine gluconate, antibiotics, and the corticosteroid antibiotic combination. If you see the essential oils in that, we discuss about the eugenol. It has been used in the endodontics for many years, and it is a main constituent of the root canal sealers and also used as a temporary sealing agents. This substance is the chemical essence of the oil of clove and is related to the phenol. The effects are dependent on the tissue concentration of the eugenol, which can be divided into the low dose, which has the beneficial effects that's inhibiting the prostaglandin synthesis, whereas the high dose have the toxic effects causing the cell death and inhibiting the cell respiration. The uses of the eugenol includes the used as an intracanal medicament and used as a root canal sealer and also the part of the temporary sealing agents. Now we'll discuss about the phenolic compounds. It was used for many years for its disinfectant and the caustic action. However, it has strong inflammatory potential, so it is rarely used as an intracanal medicaments. And if you see the uses is such that it is used for the disinfection before the periapical surgery and also used for cauterizing the tissue tags that resist the removal with the broaches or the files. Now we'll see about the camphorated monochlorophenol. It is probably the most commonly used medicament in endodontics. Presently, its use has decreased in the past few years. It has 2 parts of the parachlorophenol and 3 parts of the gum camphor, which gives the camphorated monochlorophenol. And it is used as a dressing of choice for the infected tooth. Now we'll see about the aldehydes. In that, we'll discuss about the formocresol. The formocresol contains the formaldehyde as its main ingredient, and it is used as a medicament for the pulpotomy procedures in the primary teeth. But it is toxic and mutagenic properties are of few concerns. Coming to the composition, it has the formaldehyde 19%, cresol of 35%, and water and glycerin of 46%. So it is used as a dressing for the pulpotomy to fix the retained pulp tissue. Now we'll see the calcium hydroxide. The use of the calcium hydroxide in endodontics was introduced by the Herman, and it acts like a strong base in contact with the aqueous solution, which dissociates into the calcium and the hydroxyl ions. If you see the effects of the calcium hydroxide, it acts like a physical barrier for ingress of the bacteria and also destroys the remaining bacteria by limiting the space for multiplication and holding the substrate for the growth. And they can be used in the case of the weeping canals and treatment of the phoenix abscess in resorption cases and for apexification, and also during the pulpotomy and non-surgical treatment of the periapical tissues, and also in case of the direct and indirect pulp capping, and also the sealer for obturation. If you see the advantages of the calcium hydroxide, it will inhibit the root resorption and stimulates the periapical healing, encouraging the remineralization. And the disadvantage is that it is difficult to remove from the canals, and it has no effect on severity of post-obturation pain. Coming to the weeping canals. What is weeping canal? See, if a tooth is undergoing a root canal treatment, it shows a clear or the reddish exudation associated with a periapical radiolucency. Sometimes they may be asymptomatic or they may be tender to the percussion. So when opened in the next appointment, the exudate stops, but it again reappears in the next appointment. That is known as the weeping canal. So in such cases, the exudate is not ready or for filling. Because of the presence of the exudates, the tooth is not ready for the filling, and also the culture reports show the negative bacterial growth. So in such cases, antibiotics are of no help. In such teeth, go for that placement of the calcium hydroxide. So by the next appointment, we can find the right canal which is ready for the obturation. Why this happens? Because of the pH of the periapical tissue, which is acidic in weeping stage, which is converted to the basic pH by the calcium hydroxide. So the caustic effect of the calcium hydroxide burns the residual chronic inflamed tissue, which helps in building up the bone in the lesions due to its calcifying action. So in the weeping canals, calcium hydroxide is most recommended. Now we'll see the PBSE paste, which is also known as the Crossman's paste. Here we have the penicillin, which is again effective against the gram-positive microorganisms, and the bacitracin, which is against the penicillin-resistant microorganisms, and the streptomycin, which is against the gram-negative microorganisms. And the caprolite, which is having the sodium salt, is effective against the fungi. But what happens is that the nystatin will replace the sodium caprolite as an antifungal agent and is available in the form of the PBSN. So here it is now called as a PBSN paste. Now we'll see how do we place the intracanal medicament. For that, we have to copiously irrigate the canal to remove the debris present, if any, and place the master apical file in the canal. and dry the canal using the absorbent paper points and place the intracanal medicament on a sterile cotton pellet and place it over the pulp chamber. Over this, another sterile cotton pellet is placed, which is finally sealed with a temporary restorative material. So, the intracanal medicament, in case of the eradication of the microbes from the root canal system and also for the prevention of the reinfection, it helps in successful endodontic treatment. So, this is brief about the irrigants and the intracanal medicament.